my hands first. I got my equipment. And the gate belt. So, knock knock. Hello, Mr. Goodson.
Hello.
How are you doing today?
I'm doing all right.
So my name is Jose Barrias. I'm going to be your student physical therapist assistant for today. Is it okay if I assess and treat you by touch today?
Yes.
Yeah, okay. So, the physical therapist, I see, wrote down that you have you fell recently, and now your right wrist hurts, right? So, can you tell me exactly where it hurts on your wrist? Right there. Okay. Okay, right there on like the actual wrist joint. Is it the whole thing, or just the lateral side or the medial side? The whole thing.
Whole thing.
Okay, so how bad is the pain from 0 being no pain and 10 being the most? How would you rate it?
Currently it's probably a 4.
4. Okay. So and what kind of pain is it? Is it sharp? Is it dull? Is it constant? Or does it come and go?
Yeah,
Can you describe it for me?
It's dull, but it's there.
So dull and just always there? Okay, thank you for that. And do you have a history of surgeries there? Say no. And or osteoporosis? Say
No.
no. No, okay. So, are you on any medications right now?
No.
Okay. Thank you for that, sir. So we can go ahead and work today. We're just going to be taking some measurements today for your wrist, your shoulder, and your forearm. Okay. So let me get my equipment. But do you understand what we're doing today? Yeah.
Yeah.
Okay. So first we're gonna do some measurements sitting down. First I'm gonna do some goniometry, which is the range of motion of your wrist. So the first one that we have to do is wrist flexion. So that's when you're gonna stick your arm out a little bit right here. We don't have a table, so for now we're gonna pretend that we have a table. In real life, I would have a table. I mean, in a real situation, not real life. He's gonna stick his hand out so he can have full range of motion. And then flexion is gonna be flexing your wrist downwards like that and towards the floor. Okay, so I'm gonna put this. The fulcrum is gonna be on the trapezium, the metacarpal bone, which is right below just distal of the ulnar styloid process, which is right here. So that's going to be flexion. I only have the big goniometer. So the stationary arm is going to be against the ulna, lined up with the ulna, and the movable arm is going to be parallel to the 5th metacarpal. So if I could have you flex all the way you can, right? Thank you. If I can have you straight, there you go. So for this one, I got 70 degrees of flexion, which is in between normal range. Now we're gonna do radial deviation, which is gonna be, you're gonna put your hand out like this, straight, and then you're gonna move your wrist towards yourself, so like that, to the side, yeah. The fulcrum will go on the capitate, which is the bone right here. On top, you can fill in the groove, it's a little bump. That's where the fulcrum goes. The stationary arm will be lined up with the radius and ulna towards the humerus. And the movable arm will be to the third metacarpal. Thank you. And then if I could have you move your wrist towards yourself. Is that it? Thank you. So for that one, I got 30, almost 30. It's going to be 28 degrees. The normal is 30. So it's a little bit below, but still all right. Did that hurt at all when we did those motions? Because that's the hurt wrist, right?
Yeah, a little bit.
Okay. A little bit, but not a lot?
Yeah.
It's okay. Good. So now we're going to do the measurement for the pronation of the arm, which means you're going to, you're going to have your arm that way. You're going to have, if you can sit up straight, and then have your arm against the side, the side, and then just pronate as much as you can, like that. So you're gonna do this movement, but keep your arm side of your trunk. Now do it the other way. Thank you. So this is gonna be, the fulcrum is gonna be lined up with the ulnar process, lateral of it. I'm going to look for the ulnar and the radial process, which is right here. They're parallel from each other, but they're across from each other. That's where the the movable arm is going to go, across the two styloid processes. And the stationary arm is going to go vertical, perpendicular to the floor. Okay, so I got 79 degrees, and the full range of motion would be 80. So that's almost there, a little bit below. And now we're gonna do. Now we're done with the range of motion part for sitting down. We're just gonna do some manual muscle tests, okay? Which is just to test the strength of your muscles. So first one that I'm gonna test is gonna be shoulder abduction, which is moving your arm upwards laterally like this. Okay, and then you're gonna do it with a straight arm. I'm gonna come behind you and push you up a little bit. No, go forward with the chair. Now, I'm gonna put resistance. I'm gonna stabilize the top of the shoulder, and I'm gonna provide resistance to the distal humerus. And then, if you could raise your arm upwards, and then I'm gonna apply resistance here, and you're just gonna match my resistance, okay?
Okay.
If I could have you lift it sideways, please. Sideways, up, 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 up. Now resist, but don't let me push you down. 1, 2, 3, okay? That's good. So that means he matched my maximum resistance. So that's a 5 out of 5 manual muscle test. The deltoid is one of the muscles that contribute to that motion. The nerve is going to be axillary. The origin is going to be 1/3 of the clavicle, the acromion, and the spine of the scapula. And insertion is the deltoid tuberosity and the humerus. Now we're going to do brachialis manual muscle test. So for this one, you're going to sit up straight one more time. And then since we're testing the brachialis, we're going to have his arm fully pronated, his forearm fully pronated like that. And then I'm going to apply pressure just proximal to the wrist, right below the wrist, and my stabilizing arm is going to be right above the elbow. So I'm going to apply pressure here. On the count of 3, I'm going to apply resistance right here, and then you're going to flex your elbow. And I'm going to just try to push you down, but don't let me push you down, okay? So 1, 2, 3, up, okay, 1, 2, 3, okay, that's good. I did have to use a little bit less resistance, so that's a 4 out of 5 manual muscle test. The muscle is going to be the brachialis. The nerve is going to be the musculocutaneous and the radial nerve. And then the next one is going to be wrist extension. But so wrist extension. So wrist extension, you're gonna put your arm neutral, like that. I'm gonna stabilize right here. And then if you could show me that you have a full range of motion with your wrist, just move it backwards like that. Okay? Just as much as you can, okay? I'm not gonna apply any resistance here. Ready, go. Okay, so he does have a full range of motion. So that'll be, but I don't apply any resistance, and it does hurt him a little bit. So that's a 2 out of 5 manual muscle test. And the muscle for that one is radialis carpi longus and brevis. The longest is the radial nerve. It inserts in the base of the second metacarpal. And the origin is the anterior supracondylar ridge of the humerus. So in real life, I would move to the other side, but there's not a lot of room here. So I'm asking him to turn around. I was actually supposed to test your left forearm, Mr. Goodson, not the right one. So we're just gonna do the pronation again here, okay?
Okay.
We're gonna do the manual muscle test here one more time because it is supposed to be the left one. So with your arm fully pronated, you're gonna flex your elbow up, and I'm gonna apply a resistance again, okay? So ready, up, 1, 2, 3, okay? It looks like that's the same reading as the other one, 4 out of 5. And it was also supposed to be the left, for goniometry, left forearm. So I'm gonna have you one more time. If I could have you stick out your wrist, that way you have full range. And it'll be wrist extension. I'm sorry, elbow pronation. So my stationary is perpendicular to the floor, movable on both styloid processes, and the fulcrum lateral to the ulna process. Is that all? I'm gonna have to go that much. Just so then it's gonna be exactly 80 degrees, so that's normal, and a couple more degrees than your right one. So now, Mr. Goodson, we are gonna do transfer you to the bed. Let's move your phone. I'm gonna put the gate belt on you first. That way I can hold you in case anything happens. Thank you. Forget how you lift up your arms. And then, thank you. So, we're just gonna back you up a little bit, cause there you go. Now, if I could have you stand up, okay, and then just sit down on the bed and lay down upside down, or with your back on the bed. So now, just gonna fix the camera.
Get my good side.
Okay, thank you, Mr. Goodson. Now we're gonna do 2 more tests while you're like this. It's gonna be, it's gonna be hard.
Do you need me to be the other way around?
Yeah.
Okay, I can do that.
Okay, yeah, so it says, it says the right shoulder for external rotation, but the bed is against the wall. I can't.
Here, I can just move.
So we're gonna have him switch around. But yeah.
This is non-canon.
Okay. So there you go. If I can have you scoot a little bit more to the edge of the bed, just a little bit. There you go. Don't fall though.
It's a purple bed. It's pretty dense.
So we're gonna do external rotation. Where's my measurement? So external rotation. I'm gonna be right here. Fulcrum is gonna be the greater. I'll hold your arm right here. I can hold it. Relax it. It's gonna be the greater tubercle for the fulcrum. I'm gonna rotate his arm a little bit. And it's right here, the greater tubercle. So that's where the fulcrum goes. But if I could have you hold your arm straight out. The stationary arm is going to be mid-axillary line down the trunk. And the movable arm will be towards the humerus. So if I could have you Sorry about that. That's for extension. So you're gonna have your arm out like this. And the fulcrum's gonna be the olecranon process. Mid trunk. And the movable arm is gonna be towards the ulna styloid process. So if I could have you externally rotate, which means moving your arm downwards like that, as much as you can. So you can go whenever you can. Thank you. Okay. That was 80 degrees, which is in normal range. Normal is going to be 90, so it's a little bit below that actually. It's going to be, I got 82. Let me see one more time. Hold it there for a second. Okay, so I got 88, so almost normal. Normal is going to be 90. So now we have to do elbow and forearm extension. If I could have you scoot towards the middle of the bed now, please. So for elbow extension, I'm going to use this pillow right here. And I'm going to put it under you right here. And then if I could have you just scoot a little bit more, right there. Now lay your arm straight down, like this. Yeah. Okay, so that's going to be for elbow extension. Fulcrum is going to be on the lateral condyle of the elbow, and the movable arm is going to be towards the radius styloid, and the non-movable arm lined up with the humerus. So for this measurement, I got 1 degree of extension, which I think it's because the pillow, but let's move it back a little bit more. There you go. Yeah, so when I move the pillow back, it goes all the way to 0, which is in normal range. Now I'm going to have you go prone, Mr. Goodson, which means upside down on your belly. There you go, thank you. Now we're going to do shoulder extension. So for this one, shoulder extension of the arm is going to be the greater tubercle. So I'm going to find this greater tubercle. That's where the fulcrum goes. Movable arm is going to be lined up with the mid-axillary line of his trunk or his thorax. And the movable arm will be towards the, are you okay, sir? Towards the epicondyle of the humerus. So for this motion, I'm going to have you like that, and then you're just going to bend your elbow, can you go like that? And then you're going to bend your elbow upwards. So flex your elbow. Like that. Upwards, yeah. And then if you can hold it. Oh, sorry, one more time down. I need to find your greater tubercle first. Okay, so it's right there. Line it up there. Line up the stationary arm. And if I could have you extend your elbow, so move, your shoulder. So bring it backwards and raise up your elbow. And then just, I know it's uncomfortable, but just hold there for a little while. So for this one, extension, it's gonna be 60 degrees. So it's a little bit, it's less than the full range. And then now we're gonna do the palpation part. So if I could have you turn around one more time, sir. Thank you. Now for the right bicipital groove, I'm gonna look for the greater greater tubercle, which is a little bit lateral on the shoulder below the acromion. So this is it. And then I'm going to find the lesser tubercle. And then the bicipital groove is going to be right in between those, and you can feel a groove going down. And I found it right here. There's no inflammation, it feels normal. And then the left medial epicondyle of the elbow. So left medial would be this one, left arm. In anatomical position, it will be the one closest to his body. It would be right here. So I'm feeling right here. Should I get the phone?
Might as well. Fuck it, show off my bed sheets. Yeah.
So it's right here. It feels fine. And then the right second distal interphalangeal joint, DIP joint. So right second would be the right arm. And then the second digit, which is the indices. And that one, the distal one, is going to be the last joint, so it's this one right here. I'm palpating it, and it seems fine. No inflammation, good temperature, no bumps. So, yeah. Now that would be it for today, Mr. Goodson.
Mm-hmm.
Do you have any questions for me?
I don't know. No.
No? Okay. So I'm going to go ahead and go and tell the physical therapist that you're done and see what plan he wants to do for you. Okay?
Okay.
Okay, so let me double check that we're all done. Okay, yeah, so I'll go call the physical therapist. Just stay here. Let me wash my hands first. Okay. Wash my hands.